Could be 10 minutes if you learn something valuable within that 10 minutes.
I really feel like your military training is coming in here, and that's definitely something that somebody who does hire you is going to be able to tap into. Is that correct?
Yeah, very much. You know, it's rules, regulations, accountability, not regimented. I'm just Nigel. You know, the military was 10 years ago. But there was a lot of skills that I learned, a lot of techniques that I've learned, added to the coaching experiences. I've been in your position. I've been without jobs. I've been away from my children because I've got children from my first marriage and had to build those relationships. I had to learn how to be a distant dad. I've even gone through cancer and had to deal with that as well. So all in all, I've got pretty much experience in most levels through life experiences that I can use those emotions, techniques, coping mechanisms that I've learnt to actually give you some ideas.
All right, well, we've got to circle back to the cancer because you can't drop the C word and me not ask a question about it. Talk me through a little bit about that because I know nothing about your cancer story.
It was 6 years ago, I think. I was diagnosed with testicular cancer, which was great because my wife and I were currently going through the middle of IVF, so that was a good timing. I was doing some exercise. You know, everybody's always got one that's bigger than the other, and the same with breasts or same with arms, lengths and whatever. So nothing's symmetrical. But it got to the stage where I was doing some training and it was interfering with the training. And I'm a big sportsman, so I went to see the doctors. They gave me some antibiotics thinking it could just be a mild infection. Thank you very much. It did seem to change and I felt a little bit better, but I went for some scans. And unfortunately, while my wife is a sonographer as well, while I'm in there having the ultrasound scan, her face just went like thunder. The consultant was like, oh, okay. And I think within 48 hours I was on the operating zone. Okay,
and then what happened next?
It was confirmed. It was a 7 centimetre tumour. The whole testicle was a complete tumour, which scared them, especially at my age, because I think I was early 40s or late 40s at the time. And there's two types of testicular cancer. One is more for younger men and one's for an older man. The older man one can be a little bit more, thank you very much. Yeah. So there was a lot of worry about that. And I was recommended to go on a chemo trial up in Barts in London, one of the leading hospitals. So that's what I did. I took the consultant's advice, which is very rare. They tell you what they think you should do. Normally they leave it up to you to make the decision. But no, he gave me some good advice, and I went up and had to go through 4 sessions of chemo, very heavy chemo, using a single drug that would normally be at a level 2, and I was having a single drug at level 10. So yeah, it took the wind out of me for a good year to recover.
Yeah. So I'm assuming that you would have leaned on quite heavily in your military background to help you. I think the thing that I'm trying to understand here is your mindset. Like, how mentally do you get through something like that?
I think the same way as we talked earlier about treating the casualties, except I was the casualty. I went into military mode, as I called it. These guys were the experts. They know far more about cancer than I ever will. And I said, right, what do I need to do? What do I need to do to get better? And they said, right, this is the course of treatment that you need. This is what we recommend for you. So I just sat there and gave them my arm. And that was my way through it. I always knew I would win. I'm a winner like that. I don't want anyone to beat me. And I just went through the treatment and I went through the recovery and did as much as I could do. I still worked throughout my whole treatment. I worked as a GP practice manager for a group practices back in the UK. So I would have my chemo on the Monday and I'd take the first week off. Second week I'd go back and do half days. The third week I was back on full weeks. Before I then had my next chemo and the third week after that. But that was my coping mechanism, sitting at home, wallowing in my own depression on how it had taken over my life wouldn't work for me. So I tried to carry on as much of a normal life as I could. I had the beautiful support of my amazing wife and my family at the time. And yeah, I took every day and did what I could that day.
But how did you not come out of these 2 situations, the military and cancer, without an element of PTSD or anxiety or, you know, whatever other words that I bandied around? Or maybe you did and you're just not telling me.
No, I think it's just the way that, as you said about compartmentalising it, that was my job. That's what I did. And my last job in the military as well was I was in charge of what we call the receiving hospital for all aeromeds around the world. At the same time that Afghan, Iraq and Bosnia and everything else were all carrying on in one. So when I was in Afghanistan and I was returning people back to the UK, I was returning them to my team.
Yep.
So I ran that team for 5 years back in the UK, receiving some like 220 casualties a week.
Okay.
Sorry, a month, get it right, Nigel. And that was heavy, everything from twisted ankles to triple amputees. So I'd already been in that environment, and you watch those lads come out of their ambulance or back of the aircraft. You watch them going onto the wards, which was my job, the transition from the bed in Bosnia or in Afghanistan to the bed in Birmingham in the UK. But I would then be taking next patients the next day to get to see the same guys. So I would watch the guys' transitions from arriving from acutely injured to literally leaving with their false limbs on crutches, and huge success stories.
Yeah.
So I would take the positives. That's the way I've always coped, is to take the positives out of a situation. So yes, these guys were bad, yes, they were injured, and yes, I lost a lot of people. But ultimately, 95% of my people are now living lives. I met their families, I met their wives, I met their mothers, and these guys are success stories. So I took the positives out of the role, and it's the same as I've done in most of my career. I know that I did that job. I brought back 5,000 guys, I think, over the time I was there, and I'm proud of what I've done.